each step now is very unfortunate given the completely preventable nature of this disease and the vaccine that has been readily available now for more than 10 months. It's very unfortunate to have that many fatalities and leading the world, really, unfortunately, in our fatality rate, which is not good.
Well, we've been world leaders, we, the United States, in so many areas, both for good and bad over the years. I guess this will just notch this up to the tremendous power of such a great nation as ours. Let's talk about the numbers one more time. I know you reviewed briefly, but let's see where the trends are headed.
Yeah, absolutely. So nationally, it's a bit of a mixed picture. Case rates now are at a little below 107,000 per day as a 7-day average. That's about a 50,000 person decline over the last month or so. Hospitalizations have also seen a decline, 14% decrease in the last 7 days. But remember, that is nationally, so we do have many places now still where the capacity is well above 100%. And others now with some availability. Our 2-week positivity rate across the country is at 6.4%. Fatalities, as we spoke of, has now exceeded 703,000. Let that number settle in for a moment. Almost 1 million people have lost their lives to what is now a preventable disease. All of this being driven by the unvaccinated individuals in this country. Only 56% of the eligible population is fully vaccinated in this country, so well below where we actually need to be. In Colorado, a little bit different scenario. Our numbers have really stagnated. They've what we call a plateau. Over the last several weeks, they haven't really gone down at all. They sort of stayed level. So we're averaging a little over 1,500 cases a day as a 7-day average. And our 2-week cumulative incident rate is at 395 per 100,000. The vast majority of people in the hospital are dying, are still the unvaccinated. 77% of those currently hospitalized across the state are the unvaccinated. 88% of our ICU beds are currently in use across the state. So well over 900 people currently hospitalized in the ICU across the state. Test positivity here is at 6.8%, a little bit above the national average. Here in Colorado, again, being driven by the unvaccinated. Our immunization rate here, fully immunized, we're at roughly 70.6%. Still well below where we need to be as a state, and may explain why it is that we're not seeing that decrease that we're seeing nationally. In Clear Creek County, over the last 2 weeks, we've seen a decline, but it's now what we're seeing across the state is stabilization. If you recall, just a few weeks back, we had the highest number of cases in a 2-week period that we've ever had. So, unfortunately, the last week we've added an additional hospitalization and fatality in our county. And our 2-week cumulative incident rate is at 359 per 100,000. And test positivity rate is now at just above 5% at 5.4. In the county, same story, being driven by the unvaccinated. And our testing updates, we now have testing available 3 times weekly. Georgetown on Mondays from 8 to 2, and twice in a week in Idaho Springs, Tuesday, Thursday. Available to any and all. It's free. Appointment is necessary. You just need to go online and make that schedule and then show up for that test. Vaccine clinics, continuing that each week on Wednesdays at the new health clinic on Minor Street. And we'll be there from 10 a.m. to 2 p.m. We have both the Moderna and the Johnson & Johnson vaccine. In Safeway in Idaho Springs, as well as a number of places in Evergreen, have the Pfizer available.
And those are free, of course, anywhere that they're available. Let's always remind people of that. You know, Dr. Ryan, I don't know what to say about this, but I have read a number of things recently from, I don't know, sociologists, other people in the know, that say that the strategies that have been used to try and convince that last portion of the population to become vaccinated might even be counterproductive. It leaves me just wondering what it is that needs to be done other than to just mandate and require a vaccination. I don't know what other option is available. If facts won't do it, if free vaccines won't do it, if making it convenient won't do it, what other option do we have?
It's a great point, Mark. To be quite frank, in all of my professional experience, in all of my education, I'm at a loss. I have individuals who email me and call me who aren't vaccinated, who are never going to get vaccinated, who state the reason and rationale is, I don't know what's in it, it's unsafe, it's untested, and yet out of the second end of that conversation, they say, you should look into antivirals, and we should be promoting those, and we should be promoting treatment and advocating for that. And just for the record, as a fact-based source, antivirals that are out there that are currently used for treatment, there are several things that you should know about them. The first and foremost is they cost thousands and thousands of times what the vaccine is in terms of its cost for the recipient. The second is one prevents a disease and the other treats it. The third point is the medicines that are used for treatment are far less tested, and the clinical trials that they have undergone are pale in comparison to the clinical trials that have happened for the vaccine. So I'm a little confused when people say, I don't want A, but I want B, because I trust B more, even though B has not nearly the evidence. We've given out billions of vaccines across the world for COVID. The number of people who have been treated for COVID is pales in comparison. It's in the millions, not billions. So I'm a little confused as to how that rationale fits into their head of I don't want A, I want B, when A is far more trustworthy, far more effective, and far more efficient, and far more tested than any antiviral treatment.
I am so glad that you went down that path, and I don't want to get too sidetracked, but I do want to say that there is something going on in this country that I've noticed for decades, that people would rather rely on treatment than prevention. And I don't think it's just COVID-19. I think that there is a general perception in the public's mind that if I become ill, then the doctors will fix me. And I have to say that there's nothing in the world that I think I want less than to become ill. And I just don't understand that rationale. I know that the medical profession has worked long and hard to gain the confidence of the public, and they should be doing that, but not at the detriment of prevention.
Absolutely. And never mind the cost of the treatment and the resources needed and necessary to use that. And it explains partly why it is medical treatment in this country is so expensive. If that's what our go-to is treatment rather than prevention, it's why we're in the situation that we're in. So we're strongly encouraging anyone and everyone who has not been vaccinated yet, whether you've been COVID positive or not. We strongly encourage you to get vaccinated, and we encourage you to do that as soon as possible. For those who are unvaccinated, as you are seeing week after week, it's not a matter of if you're going to get it. It's a matter of when. So that's an unfortunate reality.
Well, it seems to be, that's for sure. Let's talk about the local school district for a moment. I know that subject came up briefly with the county commissioners earlier, but I'm interested in the testing regime that's going on and the percentage of eligible vaccinated students and compliance and all the rest. I know you've got your finger on that, and it's so important to our overall success here in Clear Creek County. Can you bring us up to date on what you know?
Absolutely. So there is testing across the district. The middle school, high school is testing 90-plus kids a week. The student athletes, regardless of vaccine status. And vaccine status right now in the middle school, high school, as they're the only kids eligible to get vaccinated, is still below 35%. Also, one of the reasons and rationale for the continued weekly testing. When your vaccine rate is that low, it's imperative that we understand what is being brought into the school. There is testing going on at the elementary schools as well for unvaccinated staff and or students who want to get tested with their parents' consent to get tested. So that is happening across the district. We do have, obviously, we've had a number of cases across the district with varying degrees in each school, some doing very well and others not doing so well. And so that's an ongoing effort. The mask mandate is in effect, and it really comes down to how well it is enforced, not only within the school, but within the classrooms themselves. So, again, we see varying levels of effectiveness with that as well.
Oh, that's interesting to me. I would think that with the mandate, even in the classrooms, the teachers right there, and they'd have authority over mask wearing. And I don't know, maybe things have changed since I've been in school, but when the teacher said to do something, there were strong repercussions if you stood up to that. Maybe that's different now. I don't know.
Yeah, I'm not in each classroom or in each school. So it's, perhaps bears out by the numbers that we see in terms of cases and going on in each school.
Does the mask mandate extend to bus riding?
It does. It's obviously, again, it gets back to on the bus. Who's enforcing it on the bus? It's the bus driver. The bus driver obviously has a job to do and get the children safely from A to B as their primary objective. So, again, it's varying degrees of effectiveness in terms of the enforcement on the bus, given the number one responsibility of the bus drivers. So.
Well, that's certainly true. I wanted to extend our investigation of the pediatric population and ask you what you know about the Pfizer authorization for 12 and 5 to 11. Is that the exact ages? But I know that's a process that's ongoing. You might have heard some things that would be helpful to know.
Yeah, so I'm sure generally people know Pfizer submitted their data. And when I say data, it's a very, very thick binder full of data and submitted that to the FDA and the CDC, who are now at this moment under review of that data. We're hoping that they have a meeting in the next several weeks to determine whether that is in fact safe and efficacious for the 5 to 11-year-old age group. And then, as we've discussed before, the regulatory process that needs to go through, there are a number of steps necessary that will take several weeks, even once they have finished analyzing the data. So, in all probability, we won't be vaccinating any 5 to 11-year-olds in the month of October. It will likely move into the month of November. And we'll do that as soon as we get the green light and hit the ground running. We're already having flu clinics, as an example, in the school and disseminating the flu vaccine out in all of the schools in Clear Creek County over the next week or so.
Well, that's good news to hear. I've got my flu vaccination. I feel pretty good about that. I remember when there was they were reviewing the data for the emergency authorization for Pfizer and Moderna in the initial process, and I recall reading that it was in excess of 100 pages of hard data that dozens of different scientists had to review and comment on during that authorization process. I guess when you say a thick binder of data, it's a similar process they're going through this time.
Absolutely. It's multiple teams. So I know we've talked about this before, but sometimes it bears repeating. The FDA has a exterior advisory group, which is made up of scientists who are academics at universities doing research. They're the top virologists, top immunologists, top toxicologists in the world. And those folks, for free, are working and reviewing this data for the FDA. They're the sort of the first line. They review it, they come together and meet, and that has been a public meeting that you can literally watch and discuss it. And once the advisory committee says yay or nay, then it goes to the internal FDA group, who is made up of similar brilliant minds who review said data. And if they come to the same conclusion as the external advisory board, it is only then that the FDA says, yes, we fully approve this. At the same time, the CDC has a parallel group and process that they go through to review the same data. If they have questions, obviously they would reach back out to Pfizer, ask for additional data, ask for additional information on that. But the process is the same for all vaccines. There's no exceptions made for COVID. The process is exactly the same. It's incredibly thorough, as you would want it to be, and the review goes on in that process. It's likely, even though Pfizer, the vaccine, has been given full approval for adults, it will likely be authorized under emergency use authorization for this younger group. It would take a separate review process for it to be fully authorized moving forward. So that may happen simultaneously. I don't know. I'm not obviously a fly on the wall in that room, although I would love to be. It's a very thorough process that they go through, and so hopefully they can get through that in a timely manner so that we can get our children fully protected.
Well, it certainly is a rigorous process, and we would expect nothing less when you're talking about the safety of our children or anyone. Let's face it, if you're going to allow a drug to be sold in this country, there should be no question whether it works and it's safe. And so, speaking of drugs, I hate to even bring this up because it's just another reason not to become vaccinated, but it is in the news that Merck has an oral antiviral medication. I'm not going to try and pronounce the name. I can't do it. But it hasn't been approved yet, but they say it reduces has the potential to reduce the rate of death and hospitalization by half. What have you heard? What do you know?
Yes, Merck has come out with this drug. Again, it's a treatment, so you have to have COVID in order to take it. It is probably far more expensive as a treatment than a preventive measure like a vaccine. It isn't going to change the game here, not now anyway. Moving forward in years to come, perhaps, but not now. It's not going to change the game. The only thing that's going to change the game in this country is to get folks vaccinated. That's just the reality of it. The clinical trials, interestingly enough, for this drug pale, again, in comparison to the clinical trials that were done for the three vaccines that we have in this country, on a scale of probably 10 to 100-fold in terms of the number of individuals who were enrolled, in terms of a number of different metrics that they look at. So I'm of the school of prevention. That's what public health is all about. It's about preventing things from happening, not dealing with them after they've happened. And so I would advocate strongly to get vaccinated and not rely on a treatment to only cut down your potential of dying by 50%. Those are not odds I'm really interested in partaking in. I would much rather have a 90 to 95% efficacy from keeping me out of the hospital or dying to begin with. And then, if I end up in the hospital by 5 or 10% chance, perhaps maybe then I would take a treatment. But trying to prevent myself from getting into what is a ridiculously expensive system that we have in this country, to begin with, is what I would how I would approach it.
And by the way, that drug isn't even available as of yet. So if that's your plan, your backup plan, sorry. I want to ask you a question that has a personal origin. I was speaking with a brother of mine who lives in Georgia recently, and I hadn't spoken to him with him for some months, and I discovered that he had contracted COVID. He had a serious enough case, but was not hospitalized. But I asked him if he was vaccinated after the fact, before or after, and he said, no, I'm not vaccinated, and my physician told me I didn't need to be vaccinated because I had antibodies from the treatment. That's not my understanding, and I said that to him. It's not my understanding that that is as protective as the vaccination. Can you speak to that?
So fairly complicated question. What we do know now is that individuals, for example, who have had COVID in the early months of this, not the Delta variant, the level of protection that those individuals have wasn't sufficient to protect them against the Delta variant. So will you have antibodies against it? Absolutely. What the Delta variant showed, though, is that even though you have an antibody present in your body and a history of having had COVID, it doesn't necessarily, as the virus mutates and comes out with new variants, like the Delta variant, for instance, it is different enough that your body doesn't necessarily recognize it as the same thing. So the antibodies aren't as effective. Vaccines are far more broad protection. It's kind of like an umbrella. As opposed to holding your hat above your head, protecting you from the rain, that would be COVID. The umbrella is more like the vaccine. It protects a much broader spectrum in any potential variant that comes out. So, but like all of these, even the vaccine, there's still a 5 to 10% chance that you get it. So it's nothing's 100% effective. If you've had COVID in the past, will you still have antibody protection? Potentially. Everybody is different. It very well may wane in 6 months. It may wane in a year. That data and knowledge is still being collected literally as we speak. Additionally, with the vaccines, trying to understand how long does each of the vaccines last in terms of the protection that it offers. This is all incredibly complicated by the fact that we have case numbers that we still do in this country. So it's quite possible that a new variant comes out of what is now our reality here in America, where we have 100,000 plus people getting COVID on a daily basis. And as we talked about before, that's probably a fair underestimate of what is real out there. So the best way to protect yourself is to get a vaccine. It offers you the broadest spectrum of protection, the likes of which a prior diagnosis of COVID may not. That's not conclusive. Nobody knows that for 100% sure. But if you are interested in self-preservation and protecting yourself, I would advocate for getting a vaccine. Now, there is some debate of, do I wait a month or 2 months or 3 months or 6 months before I begin that process? And that's a fair question. How long does your antibody response last naturally? It's probably not as robust as the vaccine in terms of the duration of that protection. So if you've had a prior diagnosis, I would still encourage you to get vaccinated into the future.
Well, what I said to my brother, as one layman to another, I said to him, you've just gone through this incredible ordeal. Why wouldn't you become vaccinated and reduce your chances of ever going through that again? I mean, that's just as simple and plain as it can be to me. I don't know. But nevertheless, I wanted to move on to another subject, and that is the Delta variant wave. It started to really accelerate, let's say, the end of July and into the 1st of August. And if I look at the chart of that in that interactive chart that they have on the New York Times and on the CDC, you can compare today's level of infection, daily, a 14-day average infection, which is around 100,000 right now, it compares to where we were at early in August, let's say 2 months ago, when it was rising dramatically. And even though there are pockets around the country, including Clear Creek County, where the case rate is fairly stable, it seems on a national level as though we are perhaps coming down out of the Delta wave. Do you think that your crystal ball, I know what you're going to say, but I'm going to ask you anyway. Do you think that we are, this is a positive and enduring trend that we're in? And what's the potential going forward? I don't see how we could have another wave as deadly as this Delta, based on the people that have been infected and people who are vaccinated. Long question. Sorry about that.
Well, Mark, if I've learned anything over the last 20 months, it's that anything is possible. Is the data right now nationally promising? It is. Absolutely. We're headed in the right direction, and that's down. But now, with cases in excess of 100,000 a day, we have a very long way to go down. So we started, as you might guess, very high. So any decrease is excellent. It's certainly headed in the right direction. But if you look at states like Colorado and our neighboring states, Wyoming and Idaho, COVID is absolutely out of control in Wyoming and Idaho. And so we're seeing those folks from those states come here for hospitalization. So nationally, yes, the trend suggests that we're headed in the right direction. But as we've learned over the last 20 months, that can change quite quickly in a matter of weeks when COVID and the Delta variant find a new home in a new population, in a pocket of the population that is unvaccinated. But, you know, there's only so many people. And you're either going to get vaccinated, you're going to get COVID, you're either going to be hospitalized, or you're going to die. Those are literally the four options. So eventually we're going to run out of people in terms of you're either vaccinated or you are COVID positive or have been COVID positive. So there is a potential end to it from that sense. But again, if history tells us anything, there is the possibility of a new variant developing over the next several weeks and months and beginning to spread the way that Delta didn't. So I think I've learned enough over the last 20 months to make any prediction with any certainty other than to say really anything is possible. I think nationally we're headed in the right direction. We're not nearly where we need to be, but vaccine rate is going to need to increase to really get us out of these woods. You know, I don't think anything else is going to change that scenario.
Well, it's been a grim 20 months. There's no question about that. We don't need to make projections into the future to look at what's happened and say, oh my gosh, how could we possibly have lost 700,000 souls? It's just beyond belief to me that people have become nonchalant about the potential deadliness of this disease. Nevertheless, I did want to say one more time before we stopped our interview today that prevention before treatment is always the answer, and I look so forward to the time when you and I will be able to talk about prevention of other deadly diseases that are endemic in our community: smoking, alcohol and drug abuse, mental illness, so many others that we can prevent or mitigate, and we just need to do that for a healthy, productive, and happy community.
Absolutely, and as the saying goes, an ounce of prevention is a pound of cure. It's far cheaper, and I would rather be stopped going through the window by my seatbelt than have a physician try to piece me back together because I went through the windshield. And public health, that's what we're all about. We're about preventing things from happening and trying our best to mitigate the situation that is out in the world and do what we can to make sure that everyone leads a healthy and happy life.
Well, the day will come when we'll have those extended conversations. In the meantime, I'm going to keep wearing my mask in public. I'm going to keep social distancing while I am in public, and I'm going to keep washing my hands and making sure that I'm not spreading COVID or anything else, or contracting, or trying to put up a barrier at least as best as I can. Dr. Ryan, do you have anything else you want to add today?
No, just to your listeners, if you're unvaccinated, please get vaccinated. I can't stress that enough. If the 703,000 dead aren't indication enough of how serious this is for you, I don't know what will. So I would strongly encourage you to do that. It's free, readily available. It's literally 5 minutes of your time, and it could save you a lifetime of misery.
Thank you so much again, Dr. Ryan. We'll speak with you again soon, I hope.
Thank you, Mark. Have a great day.
Bye now.